On our mobile app, tune in, iHeart, and the Odyssey app. We go where you go. AM 1220 KDOW.
You're listening to AM 1220 KDOW.
Sponsored by The Way to My Heart Incorporated.
Welcome to the Heart of Innovation. 60 minutes that could save life and limb, with new breakthrough ideas and innovation changing the healthcare landscape. Brought to you by patient advocacy group thewaytomyheart.org in partnership with Abbott. Here are your hosts for the Heart of Innovation, Emmy Award-winning journalist and founder of The Way to My Heart, Kim McNicholas, and interventional cardiologist and founder of the Save My Piggies Health Education Series, Dr. John Phillips.
Hi, everyone, and welcome to the show. I have a really grim statistic for you. I know Dr. John Phillips is going to love this one. Every 20 seconds, somewhere in the world, someone is getting a limb amputated due to a diabetic wound that will not heal on their feet. It, in a large part, is due to lack of blood flow. But also the other half of it is lack of proper wound care. And so today we are going to be focusing on cutting edge technologies that are advancing wound care for specialists around the world, putting them in the hands of clinicians everywhere. It's all in an app called Wound Care Pro, and it is by a clinician, and Walsh, who is going to be joining us today. So we're really excited to have her. The wife of one of our patients had posted about this on LinkedIn, John. And I was like, whoa, I'm hijacking this conversation. And
not you.
Our friend, I know, right? Victoria ended up introducing me to Ann Walsh. I love social media. You know me, love social media. This is the perfect instance where it is so beneficial making those connections. So yes, and Victoria is even going to join us to share why she is a big fan. She's also a nurse herself, and she is going to share why she's such a big fan of this technology and why she shared it on LinkedIn. And then we're going to also be joined, of course, by Ann Walsh, the founder of this app.
That's fantastic, and it really dovetails into several conversations I've had this week regarding wound care or lack thereof for our patients. I am a proponent of, and I've said this in the past, the role that I play as an interventionalist. I am a plumber. I don't do wound care. I don't know of too many, if any, interventionalists do wound care. I know some vascular surgeons do it, but at the end of the day, at least in my opinion, the quarterback of that patient, meaning who's driving the treatment plan for that wound, is someone in wound care, typically a podiatrist or maybe a ortho foot and ankle specialist. But we are actually taking at Ohio Health, doing a deep dive into our amputation rate, which is no higher than that of the region or the country. And it depending on like how you run the numbers. We had, I think, 27 major amputations. We talk major amputation, we're talking above the ankle over the last several years. That's 27 too many, in my opinion, but sometimes they'll quote horses out of the barn. And one of the cases that we reviewed this past week was a woman who had all the risk factors for peripheral arterial disease, which we spoke of: diabetic, high blood pressure, dyslipidemia, things of that nature. And she, in October of whatever year it was, got like her dog scratched her or something. And we hear this and see this
all the time.
It took until December for her to have the end of December, frankly. I think it was January 1 when the result was provided, not even to us, but where she had non-invasive testings to assess arterial flow. And by that time, the wound had progressed. Ultimately, my team was able to kind of expedite and get her seen by vascular specialists and this, that, and the other, but it's too late. My point is, it took over 2.5 months for someone to put the dots together. Like, this wound isn't healing. If they would have evaluated her vascular supply, they would have known it was abnormal. They would have got the testing. We potentially could have saved a leg. No. She ultimately developed, so she lost her right leg. She ultimately developed critical limb ischemia on the left.
Oh no.
That because of what happened on the right, everybody was a little more aware. She was referred to me. We were able to revascularize and save that leg. But again, this conversation, we have it all the time. Yes, we're great plumbers, we're great interventionalists, but we're not. How are we getting these people appropriate wound care? How do we raise their awareness for their wound to get them to somebody that can help them? So I'm looking forward to talking to Ann, hearing about the app, learning, and maybe using AI to like take those human errors out of it to help preserve limbs and lives and save the piggies.
Oh, I mean, I deal with this every day, and I just had a doctor over in Michigan that he had revascularized a woman's all clear down to the pedal loop, and was on track for healing, and it was improper wound care that ended up leading to it just becoming so infected that she calls me one morning and she says, "Kim, oh my God, you got to see this video." And I was like, what's going on? And so I'm waiting for this video to come through, and maggots had infiltrated her wrapping and had infested her toe. Now, granted, and I'm curious what even Ann thinks, and I don't want to get into a whole conversation about maggots, but I'm going to tell you, I've had to work behind the system to help another patient actually get a prescription for maggots. And then we facilitated through the Global PAD Association, ordering those maggots, paying for them, and getting them shipped to the patient, and bringing in an experienced home care nurse to be able to administer them and remove them. And it was squeaky clean. So when this patient went to the hospital, this one just recently went to the hospital, and the maggots were in there. They left them in, thankfully. And I said, you need to ask them, if you're planning to leave them in now, and that which proves that you think that they were, why don't you prescribe them for patients? And the doctors just leaned over and whispered, and she shows me, this is what he did. She said, he's like, money. I was like, well, that's not okay. So anyway, so many questions about wound care here. You're laughing. Have you ever had a patient that's had maggots like that?
Yeah. In fact, we took down this was a few years ago. We took down a dressing from somebody's wound that kind of was coming to the cath lab for me to do a procedure on, and opened it up, and maggots were everywhere falling out. And obviously the first reaction is gross, disgusting, but clearly they're cleaning out the wound. The more concerning thing was, because it's a larvae, so there's a fly. I was thinking, gosh, how did they get into this person's hospital bed and then manifest that way?
Okay, that my question too. I don't understand. Where do they come from? Do they literally just come out of thin air? I mean, it's
a
amazing.
Fly that lays an egg, and then the egg is that's the thing. So I was like, gosh,
so quickly.
Do we need to kind of like shore up the cleanliness here or what? But it was but the problem was the gentleman's leg was the tendons were showing, and it was non-salvageable. So you look at the wound and you think there's nothing we can do here, and he ended up needing a BKA. I didn't even do the procedure because there was no point, and that's another frustrating thing.
But it's just that it gets to that state, and then to think that still nature's creatures, nature, what was put on this planet, actually does a better job than a lot of the artificial stuff. I mean, we could get into fish skin and all this other stuff and why it's not being used. The natural stuff. Oh my goodness, my favorite from, remember, Nurse Practitioner Kay? She was heck bent on, you need to use Manuka honey, Manuka honey, Manuka honey, Manuka honey. Why do people betadine everything? Why don't you just use Manuka honey? And
We're
I can hear
more about Manuka honey and its properties here on the Heart of Innovation here on 1220 AM KDOW. Don't you go anywhere, guys. Let's have this great conversation and keep going on.
Leg health can indicate
Man,
risk for
he
heart
got me
attack,
on that
stroke,
one.
and
He totally got me on that one. Sorry, Ann, we went on a tangent. But
Oh, no,
John,
I'm enjoying it all. Thank you.
were you our amateur backseat wound care conversation? Our frustrations with it. So I'm thinking that it would be interesting for you to comment on everything we're commenting on and get into It's probably what you're most frustrated. I mean, I just don't understand the inconsistency in wound care, the lack of interest in so many doctors and clinicians to adopting new, more advanced techniques, the overuse of betadine. I think it is I have podiatrists that are top that tell me, no, do not, like, I rarely use it. It mummifies it. It kills the good bacteria. Where's your Manuka honey? And I'm like, oh, wow. And then I say that to a, community hospital wound care person. They're like, no, what are you doing? You need to keep it dry and dry it out. And it's like, whoa, where's that balance? Anyway, I'm going to if you want to comment on anything that we did, John, do you want to take us back and then introduce Anne? She is the founder of Wound Care Pro, and we probably should get into all of her. She has like every single letter after her name.
Yes, impressive.
She is
Do we have
very impressive.
do we have time for the moment of inspiration or no?
Oh, yeah. Do you want to, what's his name? Where's Colin? Colin, do you want to take us back with the moment of inspiration stinger? I can't hear you. I know he's talking to me.
Is it 30 seconds?
That I can do. 15 seconds till we're back.
Thanks, Colin.
And thank you, Joshua. You made my day. I'll have to tell you the story later.
All right, everyone, let's get ready. We're about to be back in about 5.
AM 1220 KDOW.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Dr. John Phillips, spectacular vascular moment of inspiration.
You know, Kim, like, if ever I'm in a bad mood and I just hear that, it makes me laugh because it's silly.
Every single time.
How do you not laugh? Like, how long have we been doing this for
laugh.
2 years, and it's just silliness. Anyway,
It's the best.
so my moment of inspiration, I have 2 words. And so lately I've been reading Meditations by Marcus Aurelius. So he's a Stoic philosopher, back, way in the day of the Caesar at one point. But so there, like, Stoicism is kind of this notion of the world is unpredictable. It's brief. You have to have strong, mental fortitude, control yourself, and kind of don't let other outside influences really affect you. And so they have 7 tenets. One of their tenets is memento mori. So it basically means remember that you too must die, and we're all mortal. And that is a little grim, but I think the tenet behind that, at least the way I think about it, is live life for the day and don't postpone things, balance the good and the bad, but really, they say if you put your finishing touches on your life each day, then you never run out of time. So I would encourage anyone listening today in this conversation to just really kind of focus on doing the best you can in this short period of time and making the world a better place. Having said that, I'm happy to welcome
I think
Miss
that was
Ann.
the perfect foray into our guest.
Exactly.
Doing
So we have
exactly just that.
Yeah, so Miss Ann Walsh, she is someone who's kind of trying to make the world a better place in wound care, which we were just lamenting about how it's just there's gaps in it. She founded Wound Care Pro. And welcome to the show. Thanks for joining us. Can't wait to hear what inspired you to develop this app, right?
Yes, thanks for having me. It's great to be here. And I like the story about the maggots because I've seen plenty of those over the years. And I watched a program one time. They said a fly could smell a wound from, I don't know, like how many hundreds of miles away. I'm like, who studies this stuff or how do they know? But they get under the bandage but the wound is cleaned up. So it's not so bad sometimes. But usually the summer months and you just feel like the heebie-jeebies as the sweat's dripping down and you're in somebody's home and, it's overwhelming for the patient, of course. But I guess it's like fruit flies. They just appear out of nowhere.
Yes, they do.
They seem to. It was
Yeah,
amazing. This patient said to me, she said, I don't understand when the wound was so tightly wrapped, how it was even possible, literally, for suddenly to wake up, unwrap, and then have a sea of them.
it's
in there.
unbelievable.
Nature is amazing. I'm sorry, but if whether you're religious or not, maybe God was trying to heal. He's like, hey, I'm summoning all of you to help.
Exactly.
Send in the troops.
Send in the troops.
So
Yeah,
anyway,
no,
Anne,
yeah.
so I know we could sit here and talk about this forever. We're very casual on this show, but we want to get into, so probably part of it sounds like you're frustrated that you don't have these maggots available every day for you for every single patient. Probably some frustrations as to why, but might be one of the forays into that led to you, creating this app to show what options are available for
Right.
doctors and clinicians around the world to help create the consistency that we do not have. Is that right?
Absolutely. And when I finished nursing school back in 1995, when I got into home care, I had no knowledge of wound care. And I was blessed to have a mentor at the time. And I know a lot of other folks don't have that. And here I am all these years later, 29 years or so, and I still see those gaps that the nursing programs, medical programs aren't getting the wound care. And I see when they rotate through our hospice and palliative care, it's all new to them, whether you're trying to heal a wound or palliate a wound. So as I do, webinars and I've published, I said, what's a way to get it in the hands of everybody that wants this information? So that's when I thought of the app. And it's a good way to constantly update it when new information comes through, and then somebody has it at their fingertips. So it's, a way to bridge the gap with a shortage of wound specialized clinicians and also palliative specialized clinicians. So that was the goal with that. And I'm glad to hear people like Victoria finding it useful, and I welcome feedback to make it even more useful. I put video demonstrations in there. I've got links to other sites to get more information, more in depth, lots of pictures of patients I've taken care of over the years so that people could see what this type of wound looks like, what are your treatment options, what supplies are available, and how to use them properly. Because I do see that a lot. I'll see somebody using an alginate, let's say, on a dry wound, not understanding that is for, to absorb heavy drainage. So just constant education, not to waste the supplies, and also to hopefully heal these.
So,
wounds.
Anne, walk us through what a patient should anticipate or expect if they have developed a wound. Let's say they go see their primary care doctor. He or she notices that the patient has a wound and refers you to a wound center or a wound clinic. Is that an outpatient visit, or is that like, hey, let's get somebody to come into your home, do home health? How does that work?
Yeah, I mean, there are multiple options, but I do home health. Love being in the person's home. I feel like, you're part of the family and you can really work with them. Other times, if they don't have that availability, they may go to a wound center. But we always look at the whole patient, not the hole in the patient, when we're trying to figure out what caused this wound so that we could hopefully get to the bottom of it and, try to beef up nutrition and it's a whole team approach, multidisciplinary. So everything from the, obviously vascular, if there's vascular issues, but also registered dietitian, a diabetes educator, the wound nurse, and try to get all the team involved to heal these patients. I see a lot.
What are the questions that patients should ask to determine if they're with a wound care specialist that is on the cutting edge, that is using the most advanced tools, techniques, and philosophies, most importantly?
Yeah, I think it's important to explain what treatment you're recommending and why. And also, let's say if the patient has a pressure injury, if nobody's teaching them how to turn and reposition to get off that wound, no matter what you use, if we're not addressing what caused it to begin with. So I think just being, making sure you're demonstrating and also making sure the patient understands the rationale, and then to constantly reevaluate that wound to see, does the treatment need to change as the wound itself changes.
Do you find that the more insight you give the patient, the more inquisitive they are and I guess introspective when it comes to like evaluating the wound and wanting it to get better? Because I've seen lots of patients that my first touch with them is they have this gaping hole in their foot, and it most often starts with like a little black dot or a tweaked toenail or something. And you think, how in God's name did it go from this to this with you not, as a patient, having alarm bells going off in your head?
Absolutely. And it's sad too, if they go to a healthcare provider and nobody's looking at their feet, the person's at risk. So I think lots of education. And I think patients don't, if they see a callus on the bottom of their foot, like, oh, it's just a callus, not understanding it could be an ulcer underneath that, and it could lead to all these complications. I think it's just lack of, unfortunately, education on the providers end, that nobody's, they're not necessarily going to know this themselves. if they're not educated.
And coming up right here on the Heart of Innovation, we're going to hear from a user of the app and why she feels it has changed the game for her care for her patients. So stay with us right here on the Heart of Innovation. Don't go away. I thought I would bring up just the app. I know we have Humphrey Bogart, who's on YouTube, who asked to actually see the app. So I thought I'd just pull this up really quickly and show just how simple it is. Easy for it to use. Really cool. I mean, clinicians can actually bring it up during the appointment even and be able to take a look. So very, very easy, user friendly. So really nice job. I had a couple patients though ask me if they could get their hands on it. I mean, it seems like it's widely available.
It is widely available on the App Store and a Google Android store, but it was sort of with clinicians in mind, but certainly patients are savvy these days. They can figure it out themselves. And if they're looking at a wound, oh, my wound looks like that. But, you want to have a professional also overseeing and, providing that information, because a lot of information there, but they can get a little bit if they want, or go a hell of a lot more by links that are provided and demonstrations.
Yeah. And is this something you're doing full time now, or are you...
No, I work full time.
It takes a lot to feed the beast.
Yeah, I work full time as a wound, ostomy, incontinence nurse practitioner in hospice. But I, do this on the side. Like I said, if I attend conferences or as I'm reading, anything new comes out, I'll add it in there with pictures and demonstrations.
One of the issues that we have found at our last conference, PAD, the Lived African American Experience, we talked about the Blackfoot deceit and the lack of training on darker skinned individuals. And there was even a clinician who had come to us and said, I feel terrible that I did not notice that gangrene was developing because I just thought it was a standard discoloration of, a person of color. And we discovered through this one seminar that we did that in school, there aren't enough cadavers that are offered or participants in trials that are of darker color that could help give the experience needed for wound care specialists to be able to understand the changing skin of the people of color.
Absolutely. Same thing with pressure injuries. Sometimes you're not catching a pressure injury until later on, and it's somebody with a darker skin tone because you're not seeing the changes. So that's why you do really good assessment skills. Feel, is there a temperature change compared to the other side? Is it more indurated, a firmness, tenderness to alert us that something's brewing here? We got to get the pressure off.
Now, how long till we're coming back? John, should we start with Victoria right out of the gate?
Yeah, I'd love to. Should we tell the viewers and listeners like who would most benefit from the app, and then I guess how that translates to? So Victoria, just so I understand it, are you?
Hey everyone, hate to interrupt.
She's a
We got about 10
nurse.
seconds till we're live.
Yeah. So, but you can go back to and reiterated that it's for clinicians and physicians, but it is available on the app.
1220 KDOW.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back, everybody. Thank you for joining us on this wonderful Saturday. We're continuing our conversation with Ann Walsh, a wound care specialist who, on the side, has a side hustle, right? Developed Wound Care Pro, an app. So the app's for clinicians, right? So, like, walk us through why somebody would want to download it, and then how they use it, and then that kind of dovetails into Victoria Davis. She's one of our guests as well, who's using the app, as I understand it. Correct?
Mm-hmm.
Yeah, so there's a shortage of wound specialized clinicians. So it's hard for, if you're a generalist nurse, let's say, or a clinician in any setting, you might be like, what do I do for this wound? And the patient's coming to you. So here it is at your fingertips. Okay, it's a pressure injury, stage 2. What does that look like? What are my treatment options? It's a diabetic foot ulcer. Who else should be consulted to treat this wound, not just a topical treatment itself, but looking at the whole picture. So it's really there for clinicians to hopefully better serve their patients.
And what has been the reception
Oh, it's
for
been excellent. I got great feedback. I even had somebody the other day. She was out of the game for a while as a nurse, and now she's back in, and she called it her little pocket buddy that she carries around the app with her to wound care. And she's wound certified, but she's been sort of out of the game for a while. So this brought her back up to speed.
And it's an important point to make that continuing medical education. I always tell my patients, make sure that you do have someone who's certified in wound care, because it is an additional CME credit, right? It's an actual certification you can get. And I know a lot of vascular specialists, and I think John was even mentioning this earlier, that there are a lot of vascular specialists who are now getting their wound care certification simply because there is a shortage, and they don't want to risk actually having their patients leave their table where they have just opened up the arteries, got fresh blood flow, and then not have consistent control over that patient and consistency in wound care through their own facility. And they said that, in doing that, that's actually improved their amputation rates. But having something like, this app could help democratize access to wound care for more people.
Absolutely. And I work for hospice. We see amazing healing going on in hospice, where you may say, oh, they're never going to heal. And, if you do the right wound care and obviously treat the patient, try to get nutrition and whatever as tolerated, we see amazing outcomes.
See, that's awesome. I have a patient over in Europe, and I'm very frustrated with this situation where the patient there in England and some parts of Europe, I feel like patients are marked palliative a little bit sooner rather than later, which decreases the access they have to limb-saving care, in my experience. And so, for example, we had a patient that had cirrhosis of the liver, is ESRD, final stages of chronic kidney disease, end stage, and had a necrotic toe. And they decided that it was not, the patient could not go under anesthetic because of the comorbidities. But they decided not to use even a local to just try and open up some of the wounds. And they didn't even provide advanced wound care because, well, the patient's palliative, they're going to die anyway. Our team decided the best option was literally just to put them under hospice and let them go. And I was like, that's just, to me, unconscionable, because as you're doing, and this brings hope, at least for people here in the US, and I hope it would inspire folks in other countries, that it's the right thing to do to provide this special wound care and not let these poor patients in hospice become necrotic and literally watch the infection and gangrene grow and crawl up their leg.
Yeah,
absolutely. Can you even imagine?
I actually went to a conference in London about a month or so ago to present my poster on wound care in the hospice setting and showing these.
That's good to know.
Yeah. I mean, sometimes, of course, healing may not be possible if there's no blood flow or end-stage cancer, something along those lines, but amazing outcomes of healing that does occur. So we'll always remain hopeful.
How are you getting the word out? Well, that's what I was going to ask. Yeah. How do you get the word out? How do you just conferences? Okay.
Yeah.
So speaking of getting the word out, right?
Exactly. Good transition.
Hey, you know what? I'm learning. I'm not as good as you are with going to break, but I'm getting there. But so, Victoria, welcome to the show. You are someone who's using the app in real time. Is that right?
Yeah, so I am currently working as a wound care nurse. I've been doing it for a little over a year. And I just graduated from Emory's program, and I was a full scope student. So I'll be getting certified in wound care, ostomy care, and continence. I came across the app as a PRN hospice nurse. Wow. I also have a background in home health and hospice, so familiar with patient homes, and we do a lot of wound care in those settings. And my coworkers knew that I was going to school, and so they'd say, Victoria, what should we do for this wound? What should we do for this wound? And I was getting a lot of those questions, and sometimes, I can't recommend what to do if I'm not there looking at what supplies they have and what, do they have a offloading surface, like what's causing the wound. So I kept saying, hey, there's this app. It's not very expensive. Did you buy it yet? And I just keep recommending it. LinkedIn is a place where I kind of bookmark things that I find so that when I'm in a patient's room or, we have new hires that they might be experienced nurses, but they don't have the wound care experience like we were talking about earlier. It's definitely something that's taught on the job. And this is just, it's like having a textbook in your pocket. Kind of, Anne mentioned that earlier. It's like a little pocket buddy, and the pictures are really helpful for education for patients. And I did want to mention also, she has all of the ostomy care on there as well. So what I'm noticing is a lot of bedside nurses aren't familiar with ostomy care because they just don't do it as frequently. And so it's just a great resource. You can look at what your formulary is. My formulary for hospice is going to be different than what I have inpatient. And I can look at the categories of products and see what's appropriate to treat the wound. And I just keep recommending it over and over and over. And that led to Kim seeing it because I'm connected with her on LinkedIn. So it's kind of neat how LinkedIn brought all that network together. And thank you for the app. And it's so useful. I recommend it all the time.
Thank you very much. I noticed the same issue with ostomy care, so that's why I added that on.
Can I ask both of you, so there's a shortage of individuals going into wound care. Why do you guys, correct me if I'm wrong, but if there is, which sounds like there is because that's why you did the app, why do you guys think that is?
Yeah, it's hard to say. For some reason, it's just not a part of the nursing programs and medical programs. And then when people are out there, they realize, oops, I don't really know, and I don't know if there's not enough people going into wound care. I had a mentor and she, got me so excited about it that I went to Emory also all those years back. So I'm not sure why.
But so does it, if you do into wound care, are you pigeonholed to like home health? And if maybe people don't want to go into other people's homes we have wound care folks in our hospital system.
Right.
I know that, but I guess I don't know enough about it in the outpatient setting.
Well, I love home care, but you could be in any setting as you want to. So home care was good for me. And what the nurses will take a picture of the wound, email it to myself or my colleague. We'll look at and give recommendations. And then they have the app for education purposes and after hours when I'm off and weekends.
I do want to mention ostomy. It's the surgical opening, right? It's just any opening from surgery, right? That you're caring for the wounds from surgery. I just
and the person has ostomy themselves for elimination if they have, let's say, ileostomy. A lot of nurses don't know how to order supplies for that or how to educate the patient on dietary or how to protect the skin around, even if the actual wound is healed. So it's just like, I find that that's a problem, like Victoria said.
Do you also offer in the app the diet? Because I know that the diet is so important. Even Abbott, who has been one of the supporters of our show in the past, they have a drink, and I think it's called Jervy, that is a special formulated drink for wound healing.
Yeah, I do mention nutrition in a section of it under pressure injuries, and I refer them back to that section. And they talk a lot about nutrition and different supplements available. That's one of them, like Juven and different ones that are there that have all the essentials to heal a wound.
Do you talk about the importance of having the conversation with your patient about smoking cessation? Because the oxygen can't hop on the school bus if the nicotine's on there, so no oxygen's being delivered to the wound as long as you have nicotine in your body, right?
Absolutely. We talk to them about options to try to stop smoking if they're open to it, and constantly, revisit that in each visit.
Coming up right here on the Heart of Innovation, we'll have more with Ann Walsh talking about her new app, Wound Care Pro. So stay with us right here on 1220 AM, The Answer in the San Francisco Bay Area, streaming online across our YouTube channel, youtube.com/The Way to My Heart. Make sure you like, subscribe, and visit our YouTube channel to get more amazing content and to hear and view past shows.
Sharpen your.
That was for you, Josh.
That was
for you.
That was your best one. That was your best one ever, Kim.
That was for Josh.
Wow.
Josh has been working so hard, and he said we had double-digit numbers on our YouTube channel today.
I'm gonna look it up right now.
Oh yeah.
So y'all at 99. I'm proud of you guys.
Yay. But I'm gonna talk to Ann and Victoria over here. And I'm cornering them right here. We're live on YouTube. It's a great opportunity. We have a series we call wound warriors and would love to involve you guys and we can put your app as one of the supporters or sponsors in a sense of it, brought to you by Wound Care Pro, which would get the word out. Not only let's get patients like Diaspora, but every single week, like Wound Care Wednesday, and, do 30 minutes, answer patients' questions about wound care and use the app to
Absolutely.
show where their doctors and their clinicians can actually get the answers for it. So it could be kind of interesting. And maybe you both can kind of rotate a little bit depending on your schedules. But Anna, I think it'd be a great marketing tool for you, and it would
Oh,
benefit our
wonderful.
patients greatly.
Yes.
So,
Yes, definitely.
and plus you have our famous YouTube producer here, Josh, to help facilitate the whole thing. And
Sounds
he's
great.
amazing. So, we could just make it happen. We'll do all the graphics, everything. So
Sounds
that
great.
could be kind of fun. You
All
just
righty,
let
heads
me
up,
know.
7 up, 10 seconds till we air.
Hey, John.
Bring it back.
AM 1220 KDOW.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back, everybody. Thanks for joining us. Let's continue the conversation about wound care and newer technologies out there. So let me ask you this, Ann. The app itself, I mean, aside from kind of describing types of different wounds and having clinical literature about them, is there AI that's involved with this at all? Or I mean, everyone's talking about AI, but do you, if it's not involved already, do you foresee using it in the future to help clinicians such as Victoria out there who are maybe on an island kind of work through some of the algorithms of treating patients who have various wounds?
Yeah, it doesn't have AI now, but definitely could foresee that being and taking it to the next level for sure. I'd like to have more video demonstrations in there because I think we all learn by seeing a lot of times, and we tell a patient, "Oh, turn and position the person with pillows," and we walk out the door and they don't know what we're talking about. I shared a story years ago that I came to see the patient and I said to the daughter, "Where's mom?" And she's pointing, she's over there. She was literally buried in pillows. She said, "They said she needed pillows." I mean, it's extreme, but we need to demonstrate to them. And actually, National Pressure Injury Advisory Panel has a nice video showing how to turn the person. So I have that in the app too. So it's like 3 seconds that somebody could tap on it, show the family how they're supposed to reposition the individual in bed.
You bring up such a good point right now in terms of bed sores or the pressure wounds. We have, I can't tell you how many patients that they're in the hospital for even just a few days, and they end up they go in. We had one patient here in the San Francisco Bay Area in a large HMO hospital here, and the doctor was trying to convince her to have this axillary bifemoral bypass. And we were trying to say, whoa, second opinion, just, go in a minimally invasive way and suck out that clot in her aorta. So the doctor just left her there for 4 days until she would, come to the right frame of mind and agree with him. And she developed a bed sore on her, I'm just using layman's terms, butt crack.
Yeah.
And it got, so while we finally were able to get her a second opinion and the other doctor went in, opened up the artery, it was beautiful, just sucked out that clot. She literally had to keep going back for weeks and weeks and weeks to have this pressure sore, this wound. It just would not heal. Because the location, but poor wound care as well. I mean, prevention is so key. And is that something that you try to address in the app too, to educate people on prevention?
Absolutely. Anyone that's at risk, of course, if you're in the hospital, automatically you're at risk because something's wrong that you're in there. Most likely you're not eating enough. And then if you're immobile or whatever, then you need to get a support surface on that bed and turn in position and try to maximize nutrition, diabetes control, all that.
Yeah, there are certain types of beds that I think that you can get if you're at risk for pressure sores. I think that you can actually request. Is that correct?
Yeah, there's certain mattresses that could be put on the bed depending on what, there's a group 1 product, which is an overlay, would go over the hospital bed mattress in the home we use oftentimes for prevention. And then you step it up to a low air loss mattress if the person develops more extensive wounds.
I'm curious, just from your standpoint, there's so many people, and even, Dr. Phillips can probably jump in here on this. I mean, I'm sure there's so many times where a clinician or physician has ideas and you see these gaps in care. What was the catalyst for you to go from, I'm going to stop complaining about this, I'm just going to do something about it? And what are the steps you took to actually make this happen? Because I even know myself, I'm more of a creative, and I've been trying to develop apps, and it is not easy to communicate my ideas to a developer. And I see John nodding over there.
Yeah, I actually, probably about 7 years ago, we developed, or I had the idea. It was frustrating, right? Because you're seeing people that have this wound, and it's like, why didn't you take a picture of this and send it to somebody? So then we
Yeah.
developed something called Wound Watch, or I called it Wound Watch. And then we changed it to something called Shutter Health, which was ultimately, taken over by another company. It really honestly didn't go anywhere because it was like, so our electronic medical record that we use, Epic, but there's other ones out there. It allows folks to take pictures of things, but you want to raise awareness. You have this idea. It takes a lot of money to develop an app, at least in my experience. And it's kind of, I think, hard to disseminate the information. It sounds like it's a lot easier now with LinkedIn. And then obviously if the app works well, like Ann's app does, people will latch onto it, and then that'll help it grow. But it is not a small undertaking. And Ann, you know that as well, because there's a lot of stuff out there. And plus one of the issues that we have is integrating it with our electronic medical record. And some of them are pretty closed to third-party vendors. So that's a roadblock as well, at least in my opinion.
Yeah, it's definitely hard. I started going to conferences or doing webinars. I guess after COVID, we were more at the computer. So it was a way to access people to educate about the app. And then sometimes certain things you're not allowed to say the app, but you can put it as a resource in there, because they don't want to be commercial based or whatever. But I think that was a way to get it out there. So I've spoken with the Hospice and Palliative Nursing Association, a very popular one, because folks in hospice want to learn more about wound care and ostomy care. And then like social media, like I said.
What about this is very frequent, and I'm not trying to say that there's a black eye on nursing homes and extended care facilities, but it's not uncommon for us to see a patient whose family member went to see them. They've been in a SNF or an ECF or something. They've all of a sudden they look, the daughter looks at the foot and like, what's going on here? How did this happen? That's really frustrating for obviously the family, the patient, and then us as those proceduralists who are seeing it at the kind of the reactive side of things. Do you think that there's a role for this to be proactive at some of these facilities where you can get in the hands of maybe a medical assistant or somebody who just says, this doesn't look right, help me, kind of deal?
Oh, definitely. I mean, I guess in the facilities to have it on a webinar, on like a computer base, would probably be easier than the home. We're carrying our phones around. In the hospital, I don't know, does everyone have their phone in the back pocket? But so to be able to create that, I think would make it more accessible. But certainly they could, educate themselves so they know next time they see a wound like this, what can they do, and educate their staff, especially prevention. Like you said, sometimes it's so simple to get the heel off the surface and not let the person, after they got hip surgery, and now they got this horrible heel wound that won't heal. And then progresses, and they come out, the hip surgery is fine, and now they got this this horrible wound on their heel. Simply not putting a pillow there to lift it off the surface.
I can see Victoria nodding back there. Victoria, is there any one story that stands out where you were able to pull out this and it saved the day with one of your patients? Go ahead and unmute.
What I was actually thinking as Ann was talking was just that so when I was working hospice and home health, I did go to a lot of facilities, like we were talking about, whether it was assisted living or skilled. And sometimes they have protocols that are outdated for skin tears, is what's coming to mind especially. And the one that I'm thinking of, the protocol was that they just cover it with Tegaderm, which is not the best treatment for a new skin tear. And so one thing I think would be helpful for those clinicians, because really we want to do the best thing for our patients. Like all the nurses I've ever worked with, that's what we want. We're patient advocates. We want to do the best thing for them. And so I feel like if you have an app like this, it's being updated, it's up to date, and you could bring it to your employer, your medical director, whoever makes the protocols, and be like, hey, we do this. And actually what they found is better for the patient is if we do this. And then Anne has like the research articles behind it, like linked right there. So it could be a way to change policies, that, as a clinician, you could actually impact an organization.
Wow, that's brilliant. That's a lot of work, Anne. You not only have the information, but then you're putting the evidence behind it. That's incredible. Well, coming up right here on the Heart of Innovation, we'll have final thoughts from Anne. So stay with us right here on 1220 AM, The Answer.
Clear.
Awesome. That is really cool. That you not only have the information, but you also have the data to back it up.
Absolutely. And I actually put case studies in there too, so people could see, oh, wow, how this, and then you see the wound healed. Whereas, like you said, they may throw their hands in the air, they're on hospice, or, they're not going to heal. And they do. I mean, I had this one lady, and she was actually a retired nurse in her 80s or so, stage 4 pressure injury, bone exposed, tube fed, tracheostomy. So you think diabetic, that she was never going to heal. Healed completely, where she was literally booted off hospice in a year and a half or so. Family was thrilled. Because even though she had all these comorbidities, she was stabilized and the wound was completely healed. That we couldn't even justify keeping her on hospice.
Sorry to interrupt everybody. 10 seconds till we air. When you hear the music go on, that's 30 seconds for you to be able to talk out before the ending credits go through.
Prager.com.
1220 KDOW.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Well, everyone, welcome back to the show. And we have Anne Walsh, the founder of Wound Care Pro, who's with us. John, this has been a great conversation.
It has. And I think the beauty of this show is it's innovation, right? And we're trying to democratize and I don't think weaponize is the right term, but use technology to help people. So, Anne, on that note, what are the next steps? Like, what would you like to see this app develop into maybe in 2 or 3 years? So I look at it and like, is there a way to use the camera on the phone to show maybe the depth of the wound, or I don't, something along those lines? I mean, tell us where you want this app to be in 3 years.
Yeah, there are apps on the market now that do measure. They don't tell you what to do with the wound, but they will. You take a picture, it'll do the length, the width, and some of them will do the depth as well. You still have to get that Q-tip out and probe the edges to see if there's any underbinding or tunneling, but at least they'll give you that, and then you put that in the chart and you could track. So I would like to see this do some of that. It would be great because you'd have all in one spot rather than have an app to do the pictures and an app to measure, and then another app to educate. So, and hopefully with AI or something along those lines would bring it to the next level. And like I said, more video demonstrations, I think. Even somebody was asking me about the VAC, the vacuum assisted closure or negative pressure wound therapy, if I had an app to show them how to use that. But I told them, sure, it's already on YouTube. But even those kinds of things to have for the nurses out there by herself himself in the homes, that you're not in a hospital setting. You could say, hey, can you come in and help me or show me that you're out there? So this would be something that you could look at before you go and see the patient to brush up on the procedure.
And for the clinicians, for the clinicians that are listening, I saw in the App Store it's $4.99. I'm assuming you have to cover the cost. Or you're not using this to pay for a house in Tahiti or anything, are you?
Yeah. Yeah, it covers the cost. It's a $4.99 one-time fee, but yeah, there's cost with the security of the app and everything every year. And all these other fees. Every time they reach out to me, it is another fee. But
there's always another fee, developer fee, updating fee.
Exactly. I just said the other day, Android is going to be updated to 14. It was another cost. So it's okay.
It does. It's just constant. So it's really important to be able to go in and support an amazing clinician entrepreneur such as Anne.
100%.
I'm curious, from Victoria's perspective, anything that you'd like to see going forward with the app and integrations? I could see this being a great integration into the app CarePix, I could also see it integrating into some of those. And I do believe in like not reinventing the wheel. So I'm hoping that people will align with you and say, hey, we're going to go to Anne for the most updated education, and we're going to integrate her education into what we're doing versus reinventing the education wheel. Partnerships are always, I think, key.
Absolutely.
And Victoria, what do you think?
Yeah, I'm excited about the idea of some videos that are accessible. And so as nurses, everybody specializes, and we don't do the same procedures over and over and over. So even something simple like packing a wound, a bedside nurse or a home health nurse, they might not have done that for a while. And like I said, we want to do the best thing. We want to do evidence-based treatment, and we want to do it right. And so I just feel like a video addition to the app would be amazing. I'm already going to recommend it, but yeah, that's great. That's a great way to go. Measuring would be helpful. That would be nice. It's one less thing, save a little time. And it's not subjective, right? If you have a computer doing it, then it's not subjective in that way. It's a little bit more indicative of if the wound's contracting or not.
Can you upload this information into the patient's medical chart, or is it housed in a separate, like, is that a separate area?
Not through this app.
Not through this app. No, it's separate. The apps that some people use to take a picture of the wound and gets the measurements and all that, those you can update and upload to the whatever, if you're using Epic or any of those, depending on which one they
Gotcha.
with. Like home care.
For those who want to download this, and I have a feeling because a lot of our audience, we have a lot of patients that are watching, I'm sure they're going to want to download it and show it to their own clinicians, physicians. It's all about diaspora and creating this groundswell, right? And getting this app out there and improving the education to improve wound care and reduce those amputations. If you want more information on this app, you can Google Wound Care Pro. You can also go to the App Store, Google Play, and download it as well from there. Have a great weekend, everyone.
Thanks, everyone.
Better quality of life through
Thanks, everybody.
Education, real-time support, and
Okay. That was absolutely amazing. We're still streaming online. I wanted to open it up if you do have a few more minutes just for questions from, some of the folks in our live studio audience, and maybe Josh, our YouTube producer, might be able to throw a nudge out there on YouTube to see if anyone has any questions for you as well. I think John wants to jump in.
No, I just said real quick, like I wanted to test, this has nothing to do with the conversation today, but I wanted to test the Leg Saver hotline. So I just called that number, right?
Yes.
And Douglas answered. So kudos. I love it. Good job.
I told you, we're 24/7.
Sorry.
It's absolutely crazy. So it was popping up. It pops up on my screen on my phone. Did you see me as I'm trying to do my that is just
That was
mean.
mean of me. That was, but so I was just curious, like, how does it work? Because it's Google. Is it Google Voice?
We use it. Yeah, we go through Google Voice, and then we also have an entire back end system that we use. So we have an entire call center. And so right now it's available.
My Zoom image is there, but behind that it pops up the weight of my heart, and I just hit accept, and it cuts Zoom off, and then I answer the phone.
Which, just for those listening and are live with us on YouTube, costs money, right? So
yes,
please help us, help them. Anyway,
yeah, we could use a few donations here or there. Selfless, shameless plug.
Shameless plugs as usual.
Shameless. No, I mean, we have to pay, right, Anne? Speaking of the back end, I mean, the developers, the software, I mean, the humans behind it, it's a lot, and people don't realize. We want to offer this, this great service for people, for patients, but it costs us money. And we want to make sure it's free for patients on this. But what you're doing is even nominal. I mean, seriously, for you offering it to clinicians and physicians, so many companies have that upcharge for it, and here you are. It probably, I would think, sometimes becomes a little bit disconcerting, and you see other big companies and they put out wound care education and this and that. And you're like, you know what? Why don't you just support a, a clinician entrepreneur and promote my education through your website versus, or why don't you sponsor my app and sponsor my education, because I'm doing it from a pure standpoint. I'm not trying to sell products. I'm just trying to put out the best education out there. And even more, and I think this is great for you, is you're not worried about grander compliance issues. You're literally just focusing on the real education, unbiased, cutting edge, and evidence backed.
Absolutely.
So, and it's,
Well, yeah,
it's
almost
just,
30 years as a nurse and wound care and all this experience is just poured into that. There's a lot of new nurses now as people leaving the field or retiring, and it's even more needed to have this information in their hands.
Yeah. Douglas has a question. Douglas, go ahead and ask.
Yeah, sorry I missed part of the show. So my question about wound care is there a part in the process of it? Maybe I missed this in the show, but I was on the phone with somebody the other day and they were asking, well, when do I go and see someone at what point do I have to see a doctor for my wound? I mean, is there like a guideline? Maybe
well, if you're not seeing any results, let's say within 2 weeks or so, whether the wound is getting smaller or maybe the surrounding skin, the peri wound is improving, or there's no more bleeding, or things are improving, it's cleaner, if there was necrotic tissue, then you're moving in the right direction. But if you're not seeing that, maybe the wound's getting bigger and just you're not seeing the results you're expecting. If you're maximizing your blood glucose control, you're eating well, get the pressure off, then you want to get it checked to make sure it's not the blood flow issue or something else going on.
And people who have those high risk factors, especially diabetes, peripheral artery disease,
Right.
you want to make sure that you're a little more attentive probably than most, because you know that you're at risk, right?
Yeah.
The ones that are most concerning to me are the ones that don't even know that they're at risk and they're allegedly asymptomatic to the point where they end up with a wound that won't heal. And what we say is these patients are a toe step away from amputation and not even knowing it.
Exactly.
And that's why I like technologies such as what Podimetrics is testing out right now, those mats where it's using some sort of technology, the diabetic patient, I believe they've been testing it out with VA centers across the US, where diabetic patients can have a mat at home, and the mat will tell them if there's any temperature changes that might indicate a wound is developing underneath, and being able to address those sooner rather than later before they even break skin. And don't you wish we all had that ability to be able to see through the foot? Do you promote those types of technologies on your platform or talk about those types of things? Not necessarily that one, because that's not available to everyone.
Yeah, if I
as of
see any new
yet.
technology, yes.
And how is that presented on your app? Do you have a special section for it? What's the organization like on the app?
Well, sort of like incorporated, like we were saying earlier, with somebody with darker skin tones that come out with sort of like you could see the temperature changes on a patient, and you may say, oh, something's brewing here, same type of thing. So I'll mention, I don't know if it's out yet, but I'll mention that, for example, you could use such and such. And when it comes to turning and positioning patients, as ways to like save your back, the nurse's back. So there's a couple of brands out there. I'll just mention a few brands, never say one, just so it's fair. Yeah.
And what about things like, I'm just confused. I don't understand why fish skin isn't used more. I've seen some remarkable cases with fish skin. Is that something that you talk about, the use cases or indications for its use on your app?
I have not brought that into it yet. I do have one section on more advanced treatments, talk about collagen and talk about skin substitutes and negative pressure wound therapy and stuff like that. If the everyday treatments aren't working for the person, you can step it up to, but I can include that for certain when I get more information.
Do you feel like economics gets in the way in some wound care facilities that prevents them from being able to use some advanced therapies that might be talked about on your app?
Yeah, definitely. I think it comes into it. I think people use the supplies inappropriately sometimes. Like a lot of these supplies, wound care can stay on up to 7 days. Like the honey products, let's say, the silver products, they work up to 7 days. Not saying you're going to leave it in place that long, but you'll see maybe people using it daily, and then the facility's looking like, wow, this is costing us a bundle, and they get rid of it versus like, let's use it properly in the right situation.
Yeah. I'm curious what your thoughts are, just honestly, about the fish skin, and why it isn't something that is more widespread. Maybe there's something that I'm missing based on um, some of the newer evidence that might be out there that might say, maybe not.
Yeah, maybe the availability, and I haven't seen a hell of a lot
Oh,
on it
availability.
out there, so maybe not that's not like catching on, but I could certainly look into it more.
I've had one of my patients, and it worked really well on it, but he called me up and the next day after it was placed, and he's like, man, something's fishy. Something is really fishy. He could smell it.
Wow.
He said he was afraid to go to work because it was that evident.
Wow. My
And
cat would love that. My cat would be following me
yeah.
around.
Definitely. I'm curious your thoughts on, we hear a lot about the Manuka honey and then medicinal honey. And I've been, I had my dad that he was a walking wound because he was on Plavix and he was on Eliquis. And so he had a lot going on for a while after having a couple stents placed and a clotting event. And so I just was walking around with the bandages, and I wasn't sure whether I should use the medicinal honey over at from the drugstore, or if I could use just regular honey, but then that's sticky. What is your guidance for people when it comes to that?
Well, the Manuka honey is sterile when you get it, so if you're afraid of using over-the-counter honey or anything like that, that you might introduce some bacteria into the wound. But no, I love the honey products. We use them all the time. We're wonderful, especially if the wound is a lot of slough tissue and it's small enough. It's a good way to clean it up. Or if they're diabetic, it'll clean up the wound, and it's antimicrobial. So you got two birds with one stone, and you don't have to change the dressing so frequently.
So this isn't something you just go ahead and order, off Amazon, just general like Manuka honey. There is special sterile honey that you should look for and make sure that it's for medical purposes.
Right. There's a couple of companies that have the brands on. You get right off Amazon. Not cheap. You get a tiny little tube. It's going to cost you $15 or something like that. But if it works fast in the long run, it might be worth it.
Yeah, I've had some resistance when I've been on the phone with some of our patients. We show up as advocates for our patients at their appointments, and I was shocked sometimes at the resistance when I would say, well, what about some medicinal honey products? Oh, no, we just need to iodine. They just need to keep it dry.
Oh,
And I'm
yeah.
thinking, well, I see you giving me that same face. Well,
Yeah,
you
well,
and some of the top people give me that face, but then
Yeah.
these community hospitals are saying it's the end all be all.
Yeah, no. I mean, sometimes if the person has intact eschar, we'll say on the heel, and we don't know what the blood flow is yet, those we will keep dry and intact and use betadine to keep the bacterial count down and keep it dry until to see if the patient's a candidate for debriding it. So those are the only times basically you can use betadine if it's necrotic tissue.
Got it.
Okay,
I
gangrene.
see Dr. John over there listening intently. I'm just wondering, you're thinking pretty hard here. It's really interesting stuff, right?
Yeah.
I mean, it is, because again, I'll tell you, there's a lot of times I just see wounds that are painted with betadine, and I think to myself, okay, it must work, I guess, because everybody does it. But I will just say that, and I'm very upfront with my patients, like, yes, my role is important, but the most important thing if you have a wound is to make sure you have good wound care and you're seeing somebody who's taking care of it and helping you understand, the dressing changes and whatnot. I mean, that is by far, that's actually the reason why several trials for new technology with respect to balloons and maybe stents to some degree have failed, because the patients don't get appropriate wound care after their procedures. And for us, I mean, I'm in Columbus. I see patients from various parts of the state. They come and then we get their procedure, or they get their procedure done, but then they go off, and it's really frustrating. I know Kim's been to Italy as well, but there are sometimes in some places in Europe, there are specialized hospitals for people with diabetic foot ulcers, honestly, and they get kind of, it takes a village mentality for they get revascularization, meaning better blood flow. They see a wound care specialist. They see endocrinologists. They have this whole network of people in place to really allow for success in wound healing and limit amputations. Italy has some of the lowest amputation rates in the world, and it's probably because of that mentality.
And also lowest readmission rates, especially with Dr. Marco Monzi and Dr. Mariano Polania. They revascularize clear into that pedal loop in that foot as many times as they can. They don't care. But it's interesting because they say that they don't even have the crazy revolving doors. So they have some sort of magic touch with those patients. It's amazing. But
Well, it's
I
because
agree
they
with you.
leave, the patients get treated globally there. They leave with a plan.
An
And
actual
they
plan.
are, then the patient, I think, understands it. There's a lot more. I mean, I think the patients also realize in Europe, and we touched on it earlier, with respect to socialized medicine. You're not maybe paying into it, but you're also, I think, a little bit limited, and so patients need to be on their best behavior, in my opinion, to make sure that, yes, the doctors are doing their thing, but the patients have to buy into it as well. Because if you start, not taking care of yourself, the government may or may not pitch in to help you out, if you know what I mean.
Right.
It's interesting. I was doing some stuff in Japan, or for the Japanese trial, and they have a lot of, in Japan, they have a lot of folks smoke and diabetics and end stage renal disease, but their mortality rates are much less on with people with dialysis than those in the US, because they're just, I think, more aware of the consequences. And this is me editorializing, but it's often hard you can bring the horse to water, but you can't make him drink all the time in the US, and that's one of our downfalls.
Oh, I see that all over the world, even with the known consequence. And I have patients that'll come to me just last minute saying, I just don't understand. I have this wound that won't heal over there, and I can't get in for months,
Wow.
to go get this taken care of over there. So I see it all the time, but also I see that more and more patients are not even sent to the vascular. I think it's, at least here in the US, I think for the most part, if there is a potential vascular issue, and the doctor realizes it, they do send to vascular. But sometimes in Europe, I feel like they're just stuck with the GP. And if it's not at a stage where they feel like they have the tools and techniques to resolve that blood flow issue, they don't get you an appointment with vascular.
Wow.
Or if they do, they send you right back and say, hey, you know what? There's nothing can be done. We don't treat below the knee. You're not a candidate. And they just say, whatever the GP can do, great. And if not, then there's just nothing we can do. Go home and wait. And that's frustrating.
Yeah.
So we see it all over. I think there are gaps. And I think wound care is such a big issue around the world. And my whole thing is, and I know that John is in agreement with me, I know you are, is we've got to get the people who are at risk tested sooner rather than later. And I think the best ones to start with are the diabetics, because they can have vascular or, PAD related wounds, the lack of blood flow in the arteries, the artery related wounds, but they can also have neuropathic issues as well. And they're just so at risk for so many reasons that they just need to have a regular strategy, a regular plan. And I think it needs to be documented. It needs to be put into policy, put into practice. It needs to be law. And I know at least there was the ARC Act that they were working on in Congress that would provide, testing for PAD for all of the people at risk. But I think more especially needs to be done with wound care. And I think that if patients take advantage of it, at least in the US, and maybe there's someone that can share more on, other countries, but at least in the US, you're allowed a certain number of podiatric visits if you're a diabetic. Is that correct?
Yeah, I think it's every couple of months or so under Medicare anyway.
And it's really important, for those patients to find the right podiatrist, because not every podiatrist is created equal. I mean, you have some that are more sports podiatrists, and then you have ones that just specialize in diabetic feet. And those are the ones you want to interview and find out if your particular podiatrist is specializing in diabetic feet, right? And what are some of those questions and even Victoria, you can jump in. What are those questions that patients should ask when choosing a podiatrist? And when they get into their appointment, every single appointment, what should they, I hate using the word demand, what should they request
I
of
should
their
probably look at
podiatrist?
reviews, maybe at reviews that the podiatrist may have had, because I know when I picked out a podiatrist, that's what I went by. A lot of recommendations from the area to go to her. And, you know, you want to make sure you get a good assessment and be educated by the podiatrist. If, you know, if there's reddened areas, do I need a custom fit shoe? Can you do it? Or how does that work? And that sort of thing. It's very important.
Victoria?
Yeah, so I would say ask a wound care nurse. Which podiatrist would you go to?
Good idea.
Yeah. You know, my dad had a great podiatrist, and he did some procedures that, you know, healed some of his wounds. But then he, you know, I caught him doing wound care. I'm like, why are you doing that to one that wouldn't heal? And he said, well, this is what my podiatrist said to do. And I said, don't they have offloading felt? And he said, no, they don't carry it. And I said, okay, can you get a consult to wound care? And so we got him a treatment plan and got his other wound healed that didn't need surgical intervention. So yeah, I just, in our area, I know the podiatrists that we work with, and I know who I'd go to. And I think anytime a nurse is in a specialty, you could always ask, hey, if you're having the surgery done, or if you're going to go see this vascular specialist, who would you go see, right? And we're going to tell you our opinion.
Mm-hmm. And, you know, with those, it's interesting when it comes to wound care, it's really important that you know, I mean, it doesn't matter whether you go to a podiatrist or if there's a wound care nurse, someone that specializes in it, right?
Right. And sometimes podiatrists will come to you. We have a lot of home care patients that the podiatrists that we recommend and the social worker will recommend. They love the person and it goes to the house.
Oh, that would be nice.
Nice. Yeah.
Actually, when my dad fell, he ended up having major wound issues. You know, on his, you know, where they ended up going in and replacing his hip, and then his arm, when he broke his arm, they had to go in and put plates in, and oh my Lord. And then he had the bed sores. It was just like one thing after another. And we ended up having, and then his foot, gosh, one thing. So we had the wound care nurse coming in for the one, then we got a home care, but here it was crazy. It cost my dad $500 for a podiatrist to come to the house, which was absolutely crazy. So we went back to just doing the wound care nurses versus the podiatrist, because his regular insurance would not cover a podiatrist actually coming to the house. We couldn't find one. All we could find were wound care nurses that they ultimately did a great job. We made sure that each one was certified in wound care before we hired them and brought them in. But yeah, I was really surprised we couldn't get a podiatrist to come to the house. But I know that there are a lot in Europe that they do go to the house. There are a lot of house calls over there, which I think is amazing.
Yes.
And Josh has a question. How long should a wound take to heal over? Is there a variance between the age? Is it based on age, outside of other ailments, or basically comorbidities? And if it's not healing, probably a lot of factors involved.
Could be a lot of factors. Could be it's infected, or if it's a strange ulcer on your leg that's bleeding easily. It could be malignant. It may need to be biopsied. If it's not, I had a friend of ours that had this wound. It just wasn't closing, and every time he bumped it, it would just bleed and it close up maybe a little bit, and then open up again, and he had a biopsy. It was skin cancer. So just you know, if it's not moving the direction it should be, you get it checked.
Right. I mean, if it's not healing, so, you know, is it just an infection? Could there be a malignancy in there? Is it a blood flow issue? What are some of the other things that you should check off your list?
Also nutrition and what is the actual wound care they're doing. If like I said, sometimes somebody will use an alginate, which is for heavy drainage on a dry wound, and then you're wondering why it's not healing, because you need moist wound healing. You want to strike the balance between not too wet where the skin will get macerated, but not too dry where the wound can't heal.
I'm wondering about the balance, and this is where John, I think, needs to jump in as well. There's this balance, and you were mentioning that when you have a wound that won't heal, and especially maybe if you don't even know it might be a blood flow issue, waiting 2 weeks can make a big difference, because we've seen wounds that have had lack of blood flow, you know, change overnight. And so Josh is following up and saying, are we talking days or a week before we have that kind of intervention to get that blood flow to get that oxygen and other critical nutrients carried by the blood to heal that wound there sooner rather than later.
Yeah, I'll just say in my experience, when I have a patient that comes in for consultation and they have a wound and they have an abnormal vascular exam, we oftentimes same day, if not the next day, do some simple testing. And if that shows that there is poor perfusion and peripheral arterial disease, I'm very quick to do an angiogram and look at the arteries and try to improve blood flow. But that's only as good as the wound care that then is provided in that peri-procedural and then post-procedural time frame. I don't like waiting. There are some wounds that I'll see somebody that's had a wound since, February, and it's kind of stable. Those, yes, there's probably a component of lack of blood flow, but it's not like eminent ischemia or death of the tissue. Whereas you'll get somebody who will stub their toe, like the woman that I had referenced in the beginning of the show, or she had a dog bite or something and like had really fairly progressive over weeks, just deterioration. And oftentimes that's when you really need to get folks in. And part of the other issues that we run into now is access to to interventionalists that do this. And oftentimes we have to tell the patient to go to our emergency room in order to get treatment because they can't get in. In fact, there's a woman that we saw yesterday who needs an angio, and I can get her on tomorrow, but her insurance won't cover it unless there's a 48-hour time frame for pre-approval, which that puts her out of the window to get it done on Monday. So I'm not sure how this is going to work, but there are a lot of roadblocks that we run into. But I guess the short answer is, if there's a wound that, in my opinion, is due to lack of blood flow to some degree, I'm very aggressive with trying to assess and get them better blood flow.
Yeah.
And then you agree with that. But it's interesting you were mentioning the insurance. It's such an issue for us, and the patient, we find, I mean, if they go through the emergency, why do these insurance companies not trust you as a doctor to say in an outpatient or setting, not office-based, I'm not just talking about them, but I'm just talking in clinic. Let's say you see the patient, they're getting to you, you realize, oh my gosh, this patient was lucky to get in today. This patient needs to be on the table. We need to get this done. But then the insurance company says, well, they didn't go through the emergency room. Therefore, they're not an emergency. Therefore, they need to wait 48 hours, just sometimes 2 weeks in so many cases where, folks on our hotline have been up all night just coaching these patients through the rest pain to get through the night and to have that hope. It's like, okay, dangle your feet over the side of the bed. Okay, let's walk. Let's pace. Are you feeling any better? Let's have, get a little hydration in you. Are you doing any better? Do you have any sort of pain medication? What do you have going on? Just walking them through for hours in the middle of the night for weeks because the insurance. And I still do not understand that. So, for example, with you, John, if you know that you're going to be on call, let's say, today or tomorrow, or you have one of your colleagues that is on call and performing interventions, I mean, you have to go, okay, well, you could go through the emergency room, and it kind of sucks to have to say this to the patient. I mean, it does cost the emergency room so much more when a patient goes through there. So I just don't get it. But they go through the emergency room and they have the procedure, no questions asked.
I mean, again, you hate to say it is what it is, but that's exactly what it is. And until we lobby and work towards change with respect to insurance coverage, it's probably just going to get worse. But this system that we have, I have always said, is the best in the world. I've been to other countries. I wouldn't have it any other way, but it will go broke at some point in the future. And we can't continue to see these costs just balloon. And then ultimately, the bubble will burst at some point. And you have to have very frank conversations with people. The one thing that I really struggle with, folks are living longer and they are getting sicker, and yet we have tools to help kind of get them by. But, there's a certain age, I don't know what it is in the UK, where if your kidneys fail, you're not going on dialysis unless you're paying cash. I'm not advocating that here, but at some point you have to say, okay, we're going to have to allocate resources towards certain individuals, and by doing so, pull them away from others.
It's interesting. I won't name the country on this one, but there was a situation where um, I was doing a story on a technology, and we were told that they had a patient to be a part of the study, and that they were ready for us to fly in. So we flew literally many hours overseas to this country to have this patient participate in the study with this technology. And they did the typical beginning where they say, well, what's the name? What's the, what leg, blah, blah, blah. What's the birth date? The patient was in clinic 2 days prior, fit under the law or the country's policy 2 days prior to have the angioplasty, or in this case, it was an atherectomy, done. The day before this procedure was her birthday. And she, by 1 day, no longer qualified, and they sent her home palliative. This technology would have opened up her artery. It would have saved her leg and her life. It was the most, I'm still speechless to this day that because of literally 1 day or because of the age, I've had a doctor here treat 2 elementary school classmates that they were 100 years old. And on the same day in Atlanta, Georgia, this doctor went in and opened up their arteries below the knee to keep them walking and to keep them having their daily coffees together. And they're still now, I think it's about 2.5 years later, they're still going strong.
Wow.
So
Awesome.
I just don't think that age should be a factor, because we even have, John knows, we interviewed him. We have an 82-year-old world Ironman competition triathletes that has both an AAA, it's been stented, and 100% blockages in multiple arteries in his legs.
Wow.
Amazing
And
stuff.
he's doing great.
Yeah, amazing stuff. I got to run, guys. Thanks for the wonderful show.
We
Enjoy your
appreciate
weekend.
everyone being here
Thank you.
so
It's
much.
wonderful.
Yeah, no, thank you so much to everyone for joining us. And remember, it is Wound